Hello, and welcome to our group's study on the effect of aromatherapy on heart rate and blood pressure. So, you may be asking yourself, what is aromatherapy? According to Johns Hopkins Medical Center, aromatherapy is the practice of using essential oils for a therapeutic benefit. Essential oils are combined with water to produce a steam that is expelled from the diffuser in order to inundate a room with a particular scent. Aromatherapy has been marketed as a holistic way to reduce stress and improve bodily function. There are many different essential oils that are marketed to improve or support different functions, which can include any range from reduction of stress to increase of brain processing speed. Some of these different essential oils include lavender, eucalyptus, tea tree, peppermint, and sage, which all have their own separate benefits. So, since aromatherapy is marketed to reduce stress levels, we wanted to see if this is true and effective way to reduce stress. We wanted to ask how effective aromatherapy is on stress response levels by measuring heart rate, blood pressure, and mean arterial pressure. We also wanted to know whether a background in math changes this effectiveness, whether it depends on your comfortability with math or the academic major you are in college. Another question we have is, does aromatherapy improve cognitive function? We can determine this by asking whether the number of problems solved increases or decreases, and can aromatherapy reduce the time spent on each problem? So we were measuring the effectiveness of aromatherapy on stress levels. We used an essential oil diffuser, which is commonly used in the student population for reducing stress levels. We used the lavender scent because it is well known for reducing stress. The stress-inducing activity we chose is a math problem solving sheet, which included 80 simple math questions, and the subjects were given 60 seconds to complete as many questions as they could. To determine the comfortability with simple math, the subjects were asked on a survey to rate their comfortability on a 1 to 10 scale. The subjects were also asked to disclose whether or not their major was science or math related.
After doing research on potential topics, we found a study from the Journal of Korean Academy of Nursing that had a similar objective to ours. They also measured stress responses based on aromatherapy and included control tests like we did. They recorded many variables, including blood pressure and heart rate. They concluded that the aromatherapy used in their tests significantly reduced stress levels, which influenced the direction we took on our hypothesis. Our hypothesis was that aromatherapy will reduce stress levels in students, especially students with a weak background in math. The reasoning we used behind this was that students who are weaker in math will have higher levels of stress, and higher levels of stress will cause an increase in heart rate and blood pressure. If the aromatherapy works, the students will feel a greater effect because of their higher stress levels, and students who have stronger math skills will not have high levels of stress, and the aromatherapy will minimally affect them. Some alternative hypotheses we had was that aromatherapy will reduce stress levels in students, but mostly the students with a strong math background. Students with high levels of knowledge will respond more significantly to stress-reducing stimuli due to the lack of previous stress. Another hypothesis was that the aromatherapy will reduce the same percentage of stress in students with or without a strong background in math. We thought maybe the comfort level with math will not affect students' responses to stress in reducing negative ionization treatments. And our last alternative hypothesis was that aromatherapy will not affect stress level in students at all.
The three primary objectives of our study are to determine whether there is or is not a relationship between math comfortability and stress reduction from aromatherapy, if there is any significant data that can confirm or deny the theory that aromatherapy reduces stress, allowing the subject to experience better cognitive function, and aromatherapies are effective, not just for weaker student subjects, but for a wide range of students' skill levels.
Our experimental design included recruiting 10 college students, who all ended up being male, from CSS ages 19 to 23. Pre-experiment, we sent out a survey asking the participants to identify their comfort with math on a scale of 1 to 10. Those who were under 5 were put into the weak comfort group, and those 5 and above were put into the strong background group. Before the experiment was started, subjects were asked to complete a self-history survey, including their name, age, gender, self-identified comfort with math, major, history of mental illness that affects stress levels, such as anxiety or depression, a history of test anxiety, allergies to smells, and the rate of before used aromatherapy effectiveness, if previously used and effective. On starting the test, participants began in one room where baseline vitals were recorded, including blood pressure and heart rate. Simple math problems were given to be completed in 1 minute, and after that minute was up, vitals were recorded again. At this time, aromatherapy, lavender essential oil, was diffused throughout the room for 15 minutes. Once again, students would have 1 minute to complete the greatest amount of math questions as possible on a new but similarly complex problem sheet. Immediately after 1 minute, vitals were recorded again. The photos of the study that we have include our math sheet that was used, or an example of it, the lavender essential oil that was used, and the diffuser that we used.
So our results showed that there was an increase in correctly answered math questions post aromatherapy, and that there was a greater increase in those completed questions and those with a low comfort level in math. We also found that there was a decrease in heart rate post aromatherapy, and there was a greater decrease in those with reported high comfortability with math. We also observed a decrease in blood pressure post aromatherapy. There was a greater decrease in those with a reported low comfort with math.
All right, so this first graph shows the age range of the subjects that we used. So it goes from about 19 to 23 years old, and then the other graph just shows a layout of each participant's comfort level with math. This graph shows subjects with a low comfort level with math, average heart rates went down some after the aromatherapy treatment, and then subjects with a high comfort level with math, average heart rates went down a little more after the aromatherapy treatment. This graph shows in both subject groups, low comfort and high comfort with math blood pressures went down a very small amount after aromatherapy treatment. In the group with a low comfort with math, the amount of correctly answered math questions had a somewhat significant increase post aromatherapy with about a 10 question increase. And then in the group with a high comfort with math, the amount of correctly answered math questions increased slightly after the aromatherapy treatment. The average blood pressure of subjects in the group with a low comfort level with math went down some. As you can see, the systolic blood pressure went down about 7, while the diastolic blood pressure really did not change after the aromatherapy treatment. The average blood pressure of subjects in the group with a high comfort level with math was split. The systolic blood pressure went down about 14, while the diastolic blood pressure went up about 22. This result was unexpected and could be due to equipment malfunction or subject with an above average blood pressure that skewed the results.
Overall, our data shows that heart rate and blood pressure decreased after use of aromatherapy in all of our participants, as well as an overall increase in correctly answered math problems. Specifically, a decrease in heart rate and an increase in correctly answered math problems is greater in those with a self-reported low comfort with math. This data supports our hypothesis of aromatherapy will reduce stress levels in students, especially those with a weak math background. Further study can be done on larger group populations with a more diverse population group, i.e. different ages, different anxiety levels, or different genders. Further study can also be done with a larger range of aromatherapy styles and smells. Alternative explanations of our results can range from anywhere from possible comfort post-aromatherapy can be due to a greater relaxation and relievement as the process is no longer new to the patients. Possible further study with this could include a larger gap between testing, as in a multi-day assessment pre and post aromatherapy. Possible reasoning for a decrease in heart rate could also have to do with heightened levels of activity prior to the study. And possible reasoning for a decrease in heart rate and blood pressure could have to do with caffeine intake levels. This wouldn't skew our findings, but it could change the effectiveness of aromatherapy with or without caffeine intake. Possible further study for this would be caffeine levels of participants being recorded pre-experiment, as well as an alternative day without caffeine for 24 hours.